Welcome to this edition of Pulse on Health. I'm your host, Mark LeMay. The COVID vaccinations continue to be in full swing here in the Merrimack Valley, and GLFHC is in the thick of it all. Thousands of vaccinations are in the arms of residents, and more are on the way. Joining us once again, Dr. Zandra Kelly, Chief Medical Officer of GLFHC, to bring us up to date. Welcome back, Doc.
Thank you. Good to be here.
What are some of the most up-to-date numbers as to patients having been vaccinated at GLFHC? And if you can, maybe give us some numbers about the Merrimack Valley.
So GLFHC has vaccinated almost 10,000 of our own Greater Lawrence Family Health Center patients with at least one dose. And so we've given over 15,000 doses to our patients overall. And for non-Greater Lawrence patients, so including non-Greater Lawrence patients and patients of ours, we have given over 67,000 vaccinations, which includes first and second doses. And we know that there are other people vaccinating in our area. So we know that there are thousands and thousands more who have been vaccinated.
Those are some impressive numbers, especially for a community health center. How is it going?
I would say that it is a massive undertaking, but has been going extremely well. We have, been very well supplied. So over the past many months, the state and the federal government have both worked with us, and we have found that we have been able to get a very good supply week by week. As the state and the federal government were able to increase our supply, we were able to find more people willing to work in the vaccine clinics, and we're able to increase the amount of doses that we ordered from both state and the feds. And so over time, we've been able to ramp up quite a bit. And we've also had a great success with reaching out to our patients and having them come in and be scheduled for vaccinations. I would say we've also, not only at our vaccine sites, but also reached out to a lot in the people in the community, including our folks who are do not have housing and are at the shelters or other places out in the community, as well as people who are at elderly housing groups. So we've gone out and vaccinated people outside of the health center vaccine sites as well, and a few people at home.
Are we seeing a decline in the numbers of people looking for vaccines?
So I think it's been a little bit hard to tell with the balance, because in the past, only certain people were eligible. So we know that a lot of people had been trying to get vaccine back at the point where the eligibility was narrow. Now anybody can get vaccine. And so we have more availability of vaccine. So right now we have a lot of appointments available, where in the past we had no appointments. Everything would get filled up very quickly. Right. But I think, both with more people being eligible and with us having a lot more supply and having a lot more slots available for vaccination, we're definitely seeing that our supply right now in some ways is outpacing the demand for vaccination.
We're now vaccinating 16 to 18-year-olds. Any point on the horizon to vaccinate younger folks?
Yes. So there is a lot of work being done right now, research on the vaccination safety and efficacy in younger people. We are expecting the possibility of sometime in May for 12 and older approval for the Pfizer vaccine.
So, and this might be a trick question. I want to talk a little bit about the booster shot possibility later on, but is there going to be different distribution methods? Is there going to be only one shot for the younger folks, while the older folks might get two shots? Is that any of that changing, or is that still up in the air?
So I have not heard of any changes related to the number of vaccinations required in order for someone to be considered fully vaccinated. I imagine right now the studies that are going on are continuing with 2 doses for Pfizer. I have not heard anything different in terms of the younger population. And then once booster shots are available, I would imagine that we would not go through the same kind of eligibility differences as we did in Massachusetts and across the country for the first vaccine dose, probably partly because the vaccine availability should be higher, whereas in the past, we really had limitations in terms of the number of doses available.
Let's touch upon the booster shots for a minute. And again, talk to me like I'm a 5-year-old. Is a booster shot the same dosage as the initial shots, or is it kind of a top off?
Right now, in the way booster shots generally work is it's more of a top off type idea. So when people are vaccinated, they develop immunity against the virus. And the virus has many different components. So we may develop immunity against 1 or 2 or 3 components of the virus. Then if the virus changes a little bit, the boosters may also change a little bit to say, okay, maybe we need a 3rd and a 4th component that our body recognizes on the virus, so that if we get some other variation of the virus, we will still be able to recognize the virus, the body will still recognize it, and will still attack it right away. So that's where some of the booster need comes from, but also sometimes over time, the body forgets a little bit that it has seen this virus before. And so when you do the booster, the body kind of wakes up to it again and says, oh yeah, I have seen that before, and re-revs up, the ability to attack the virus if and when it ever comes into the body.
And I'm assuming the ongoing research kind of gives the vaccine makers the heads up that, okay, we're going to need to do what you were just describing, that we're going to need to reintroduce the body to the fact that this virus is around. So we're going to add this element to the vaccine. Am I correct?
Yes. And sometimes booster shots are exactly the same as the first shots. And it's just like kind of a reminder to the body. Mm-hmm. And sometimes with especially viruses like we see with the flu shot, every year, the flu shot is different every year because the virus changes so much. Flu is very well known for changing really rapidly. The coronavirus does not change as rapidly. I think we're seeing a lot of variants now because so many people are infected, mm-hmm. that the virus really gets a chance to change a lot because it replicates itself, like crazy with so many people having coronavirus. But generally speaking, the coronavirus does not replicate as fast. Does not create mutations or variants as fast as the flu virus does.
And do you see the booster shots being something that we're going to have to do annually?
I think it's possible that will, but again, I think the reason we do flu shots annually is because the flu virus changes so much. I think that it's possible with the coronavirus that we will not need it annually, but so much more research needs to be done because we need to see how long our immunity is actually going to last in general for people. Mm-hmm. The other thing that can be helpful with getting that booster is even if, the vaccines are, nothing is 100% effective. So even if we do an extra booster, it could increase overall the efficacy of the vaccine as well, which could be helpful across the board. So I think we'll really need to watch the research and see how long the immunity lasts and whether the booster shots will really significantly increase that time of immunity.
And are there people that are being tested as booster, and I want to say the term guinea pig, but as those people who say, okay, we figure the booster is going to last 6 months, 9 months. let's see how it goes.
Yes, there are people, I believe, that are in trials for booster vaccines.
Okay.
So it is being studied. And the other thing that we can see, of course, is how many people who are vaccinated actually become infected with COVID after their vaccination. And so that information is being tracked very closely, and we can see how far out were people from vaccination when they contracted the coronavirus and things like that. So again, the vaccine is not 100% effective. The chance of getting COVID is very low after vaccination, but also we're looking at the time frame as to when they got it and how far out from vaccination they were.
So are COVID infection numbers declining in the region?
So they have in the past. Right now, within the last maybe 2 or 3 weeks, it's really been more stable rather than declining, unfortunately. And maybe about a month or two ago, it went up a little bit. So we had been going down after our winter surge, and now we're sort of steadily kind of going up and down a little bit every week. So I cannot say that it's a steady decline at this point.
And again, this might be a loaded question, but is the up and down that you're describing, the gentle up and down, okay?
Well, I think it shows that people are taking less precautions probably than they were before. And so my sense is that, as we all know, people are ready to move on. And, I think there's also the idea that there are a lot of folks vaccinated, or a lot of people are getting vaccinated. And so there's been more reopening as well. And really at this point, we need to keep the masking and distancing going. I mean, the CDC guidelines, which I think make a lot of sense, are if people are vaccinated, they can get together in private settings. But really, when you're out in the public and when you're in larger groups, it's really best to mask and distance. I think we can't forget that over 570,000 people have died in the last year of COVID, and we still have deaths every day. And so it's not gone. And I hope that we can continue to use all of the information and knowledge that we've gained over the past year to help prevent more deaths while we are ramping up on vaccination and getting everyone to the point where they are vaccinated, and we can get into those areas where those private gatherings can become larger, more public gatherings of people.
And quickly, are you still seeing vaccine hesitancy among members of the community?
Yeah, there are definitely people who have a lot of concerns about vaccination. And I think at Greater Lawrence, what we're really trying to do is reach out to the community, answer questions, hear what their concerns are, look at all the information that we have and share it. There's definitely a lot of information out that is misinformation. There really isn't anything to back up or support the misinformation that's out there. So we really try to help balance that misinformation with, real true data about what we're actually seeing, and help people to make those decisions, because they know they are complicated decisions. And one of the things, though, that I would say very clearly is that we know very well what COVID does. We know also, besides all of the deaths, we know that a lot of people have long-term effects from COVID. And these are young people as well. So people, having symptoms for months and months and months. And we are now in the medical community trying to figure out how to best treat and work with patients who have these long-term effects of COVID, even long past the time when their infection is gone. So I know a lot of people are probably thinking, I'm young, and so, it's not as much of a risk for me. But we are definitely seeing a lot of people who just do not feel the same. after having had a coronavirus infection, even if their symptoms were mild and they didn't really feel that sick from it. So I think that that's just the risk of having that happen is high when, you know, we have so many people who are still have not been infected and could be, and we're seeing higher and higher numbers of people with those side effects. So I would say that the risk is so high with COVID. The risk with vaccines is extremely low that people would have side effects and issues. So the balance really, really votes for vaccination in my mind.
As we like to say, follow the science.
Right.
We're going to take a quick time out here on Pulse on Health. When we come back, we're going to talk about the Johnson & Johnson vaccine situation and also the new rules when it comes to mask wearing, coming up in the second segment of Pulse on Health. Back to Pulse on Health. I'm your host, Mark LeMay. Our guest, Dr. Zandra Kelly, Chief Medical Officer at Greater Lawrence Family Health Center. Again, taking it to the layman level, can you explain the Johnson & Johnson vaccine situation? What caused the pause and what caused the government to restart?
Yeah, sure. So in the United States, we have this great system for monitoring vaccines. And any side effects that come from vaccines. And through this reporting system, it was noted that there were 6 cases of a very rare type of blood clot that occurs within the head. So not inside the brain, but inside the skull. That rare blood clot, there were 6 cases out of the 6.8 million doses that had been given. Mm-hmm. And so the pause was partly to review those cases and make sure that there was a clear decision about what to do. And also part of the pause was to make sure that healthcare providers across the country knew that that had happened. And so they could help monitor any patients who came in with severe symptoms or after having their COVID vaccine with the J&J. So that's what the pause was for and why they made the pause. And then after reviewing those cases and reviewing the balance again, of course, we have to balance the risk of death from COVID and the risk of all of these issues related to COVID with this very, very rare event that occurred with vaccination. So now there have been a total of 15 cases out of 8 million doses that have been given. So extremely rare. So one of the things that is being counseled now is for women who are less than 50 years old. They may want to choose Pfizer or Moderna instead because these cases occurred in those age groups in women. But that doesn't mean that if people feel much more comfortable getting the J&J in the one dose, that they cannot select to get that, even if they are women in that age group. The main thing to, again, remember is the balance between the severe effects of COVID that we're seeing versus these very rare events. And so I think that there was a pause, but then the balance really, again, votes for continued vaccination. And the other thing that I'll just say is that it's really important for us to think about how we are providing access to this vaccine and that everyone who wants it has the opportunity to become immune to coronavirus. So, this J&J vaccine, given that it's just one dose, really increases the availability and access for people who just may not be able to take the 2 days off work or who may know that they've had COVID before and they may have more side effects than others from the vaccine. And so one dose is just good for them. So we really want to make sure that those who would like to get the vaccine have that type of access.
And that was another question I had, at least from the GLFHC perspective. Is it safe to say Johnson & Johnson was being used on for the lack of a better term, the hard to reach audiences, the homeless population, the homebound population, those populations that you might not be able to get into the clinic or might not come to the clinic.
Yes, so that is generally the focus that was originally put in place with the J&J vaccine, that one dose is an excellent way to administer vaccine for people who have a lot of trouble getting a second dose or the first dose to begin with. So that's a place where, really the J&J vaccine has huge benefits. The other thing, though, right now, after the pause, is that we really want to make sure that people obviously understand which type of vaccine they're getting and can choose and feel comfortable with getting the J&J. So we are still giving the J&J vaccine, and we do have quite a few people who specifically have selected to get the J&J vaccine, and we want to make sure that they have access to be able to become vaccinated.
And just for the record, we're giving out which vaccines?
We are currently giving Pfizer and Moderna and the Johnson & Johnson. We're giving all three.
Real quick on this, I keep hearing AstraZeneca, but not in the United States.
Not that I know of. No, not in the United States.
Any idea why?
Why we're hearing it?
Why it's not being used in the United States?
I haven't thought about that question. And I think it may partly be because of just the distribution. So when these companies started making vaccine, there were multiple governments who bought out more or less, certain numbers of vaccine doses from the various companies that were making vaccine. So I think originally the United States bought, doses from Pfizer and Moderna, and then eventually Johnson & Johnson. A lot of other countries, they bought from AstraZeneca. So whatever AstraZeneca is producing probably is required to go to those other places because they had a deal with AstraZeneca, and the United States did not put that together and has been focusing on Pfizer, Moderna, and Johnson & Johnson. And I think that we have been able to get enough vaccine through those companies. So right now there is not a need for us to try to get more vaccine doses from a different company.
Since we last talked, GLFHC has opened up another vaccination site at Northern Essex Community College in Lawrence. How's that one going?
Yeah, I would say, so that is only open a few days a week and by appointment. So it's great that we have more access within the Lawrence community to have another vaccine site. And originally that vaccine site started out as being a Johnson & Johnson vaccine site because we knew a lot of our patients were very interested in getting one dose. And so right when we were going to start doing those vaccinations regularly at our Northern Essex site, the announcement about Johnson & Johnson came out and there was a pause. So we needed to make a significant shift, and we were able to get everyone in who wanted to switch to the Moderna vaccine. So I think now we are working on making sure that everybody knows that the vaccine is available there, and doing a lot of texting campaigns, social media, so that people are aware that we have that vaccine site and that we do have availability for them to get vaccine within the Lawrence community.
Governor Baker this week announced some new rules when it comes to mask wearing and the opening up of society. I'm going to put you on the spot for a second. Do you, as a physician, think it's too early, or are we ready as a society to be opened up?
So I think that one of the biggest issues surrounding this is how people decide to use that information and whether they have a measured response to it or whether they feel like, yay, we're all going out and having, going back to usual. So I think that having places open more to the public, with masking and distancing and everything else that's been in place, especially with a lot of the vaccinations that have been going throughout the community, is not a horrible idea. I think it really depends on how people manage themselves, right? I think that, if they go out and they're wearing their masks and they're staying, distance from people, great. I think when people are outside and running around like on their own, exercising and things, and they've been vaccinated, I don't think that's going to increase our cases of COVID at all. I think the concern comes into place if, with the opening, it signals to people, hey, we're getting to the end of this, and there's more laxity about the masking and the distancing and the sanitizing. And then we start to see a lot more cases. So I would just encourage people that it should be a measured response. It's not over. We can open up more, but we can do that when people are following the guidelines with the masking and distancing and sanitizing.
And finally, do you foresee vaccinations against COVID taking place similar to flu shots? Do you think they could be distributed in conjunction or in combination with flu shots? Where do you see this going?
Eventually, I hope we'll get to the place where, we don't have so much these mass vaccine sites, but we're doing it more like we did in the past, where you go to your primary care provider and you get your vaccine. I do think that at least for the next year or two, as we're not at the end of the pandemic yet, we are still in an emergency situation, that we will continue to distribute vaccine as we have, because primary care sites certainly don't have the capacity to do mass vaccination as we are right now. But I do think that as the years go on, we will get more to a point where we can do vaccine more in the regular distribution that we've been doing in the past.
As I've said before, Doc, I trust two people, Fauci and Kelly.
I appreciate that, Mark.
Thanks again, Doc. I appreciate it. Dr. Zondra Kelly, Chief Medical Officer over at GLFHC. Just a reminder, you can hear all of our podcasts via our website at glfhc.org. Just click on the link about halfway down the main page. Until next week, I'm Mark LeMay. Have a healthy weekend.